Shaping the Impact of Socially Connected Communities Efforts. I'm Joanne Lee with Healthy Places by Design, and I'm joined today by my colleagues who will be providing support to maximize your webinar experience today. Risa Wilkerson, our executive director, is with us, and Risa is going to help to facilitate the Q&A portion of today's webinar. And she'll also close the webinar for us today. Becky Snyderman is our project and events coordinator and is serving as our chat manager for this webinar, as well as providing Zoom platform and logistical support. So at any time today, if you have logistical needs, please feel free to reach out to Becky directly in a private message in the chat. So before we get started on today's topic, I want to review some logistical items that are intended to create an atmosphere that supports group learning and engagement. I mentioned the chat box, and that's a space where we can share and learn with each other. Please use the chat box to add comments, reactions, as well as any links to related resources about today's topic that you think could be helpful for others. Now, when you chat, be sure that the setting in your chat box is to everyone. That way, everyone can benefit from your comments and introductions, etc. Participant chats can be a great way to gauge how the webinar content is resonating. However, if the chat is moving too quickly and you're finding it distracting, you can always close the chat box and disable chat notifications in your Zoom setting. Another Zoom menu that I'd like to point out is the Q&A box. If you have a question for our guest presenters, please put them in the Q&A box, not the chat, the Q&A box for questions. That way, Risa can more easily manage and triage the questions that we'll be bringing forth live during the Q&A portion of today's webinar. A note that we have made closed captions in English available in this webinar, so feel free to turn on that feature if that's helpful to you. You'll notice that this webinar is being recorded, and yes, you will receive the recording and the slides from today's webinar. We'll also be sharing with you a resource guide. So you'll see that our presenters have been very generous with sharing links about data and measurement. Don't worry about having to note down all those links. You will get them in the slide deck as well as a resource guide that will be shared within a couple of weeks with all of you. A little bit about Healthy Places by Design. Our webinars are a component of our Socially Connected Communities Network, which builds and supports a movement to advance action that results in more socially connected and equitable communities. Our network has 4 components, and each of these components enables you to opt in based on individual and community needs. Our webinars are bi-monthly and intended for learning and growing knowledge. The full calendar of webinars is on our website, and we encourage you to mark your calendars on the specific dates and join us. Discussion groups are held immediately after each webinar and are designed to deepen learning. Attendees get to share and brainstorm with our guest presenters and with each other. We'll chat out a link to join today's post-webinar discussion group at the end of the session. Socially connected communities is a key focus area of our organization, and Healthy Places by Design also produces resource guides, which I just mentioned. We also have other essential resources on the topic that you can access anytime on our webpage. Becky is chatting out the link now, so you can bookmark it in your browser. Finally, peer connection sessions are tailored for networking across affinity areas, such as priority populations or specific implementation strategies. We'll be convening a peer connection session for community coalitions that are really working intentionally on social connections. So be on the lookout for that if you're a member of a coalition or partnership focused on social connections work. And at any time, contact us to let us know if you have ideas for future peer connection sessions that we can host. So now we'd like to meet you, no matter where you are on your journey to create, expand, or sustain socially connected communities. So to get a sense of where we all are in our journeys to bolster socially connected communities, we're going to do a quick poll. You should see that poll on your screen, and there are a few options that you can select. Just tell us, where are you in your socially connected communities effort? And Becky, where are we in terms of percentage of folks that have had a chance to respond?
Okay, Joanne, we were at 75%, so maybe a few more seconds.
Great.
Okay, I think we can go ahead and close the poll.
All right. Thank you so much, everyone. Now, let's begin exploring today's topic, measuring the impact of socially connected communities' efforts. I think we all recognize the value of data and the variety of ways in which it can be used in our efforts to create socially connected communities. And the use of data or indicators is an integral part throughout all phases of a community transformation effort. At the beginning of a community change initiative, data serves an important role in assessing the current status, who is experiencing social disconnection disproportionately in your community, and where to focus or implement solutions for greatest impact. Throughout and towards the later stages of projects or work areas, data helps you evaluate the effectiveness and outcomes of the strategies you've implemented and serves as an important source of information to refine or modify future efforts to strengthen socially connected communities' efforts. During the time we have for today's conversation, we're going to focus on the more objective types of data and measurement that can be most useful to community practitioners. We wholeheartedly recommend a comprehensive measurement and tracking process that also includes more subjective and important indicators like stories and testimonies that capture the valuable feelings and lived experiences of people in our communities. And be assured that we plan to dive deeper into the role of stories and narratives in a future Socially Connected Communities webinar. We'd like to delve into today's topic again by learning a bit more about you and what's happening in your communities. And we'll do this in two ways. First, with a poll that Becky is launching, where we ask, does your community collect data related to social connection? Yes or no? Becky, just cue me when you think a majority of folks have had a chance to respond to that.
Getting some quick responses up to 65%. Let's give it a few more seconds here. Okay, Joanne, we're going to go ahead and close this poll.
Great. And if you could quickly share the results or just tell us the percentage of yes, I think everyone would be interested. 50-50. Wow. What are the chances of that happening so split so evenly? Thank you. We're already learning from you. Wonderful. Now, the second way we want to get a sense of where you are around data measurement for social connections is through a chat-in. So take a moment and tell us if you answered yes to the poll that you are collecting data related to social connection, what measures do you use and how did you decide on them? So we'll give it a few seconds for everyone to digest that chat in, but as we move on with the presentation, feel free to continue chatting in and sharing what measures you use and how you decided to select those measures. All right, now the meat or heart of our content today. Today, we're so fortunate to have two people who are not only thought leaders in the social connection space, but also dear friends of ours at Healthy Places by Design. Jillian Racoosin Kornmeier is the executive director of the Foundation for Social Connection. Jillian leads the direction of the Foundation's operations and programs, including advancing social connection research and innovation. She regularly speaks to national audiences about the crisis of social isolation and loneliness in the U.S. and was a contributor to the seminal U.S. Surgeon General's Advisory on Loneliness and the Healing Power of Connection. Jillian works tirelessly toward her vision of a more inclusive future with universal access to the support needed to be socially engaged in society. We are also thrilled to be joined by Natalie Bomstad, Executive Director of Wello. Natalie has over a decade of experience leading multi-sector coalitions to drive community-rooted, equitable well-being efforts. She provides leadership on local, state, and national levels and is passionate about co-creating transformational change to the policies, systems, and structures that influence individual and community well-being through strong relationship and trust building. Recognizing the gap in local well-being data, Natalie spearheaded an effort to establish Brown County, Wisconsin's first measures of subjective resident well-being, work that has garnered national recognition. We'll hear more about that today. Natalie wears other notable hats and has received significant recognitions, including the 2020 Women of Strength Award. So please join me in a virtual welcoming of Jillian and Natalie. We'll begin our conversation with Jillian. Welcome, Jillian, and thank you for being with us. You and your team at the Foundation for Social Connection are a close partner of ours at Healthy Places by Design, but please share with our audience about the Foundation, particularly about your interest in the area of socially connected communities data and measurement.
Thank you so much, Joanne, and good afternoon, everyone. Thank you, Healthy Places by Design, for having me and the Foundation speak about this important topic. As Joanne mentioned, my name is Jillian Racoosin Kornmeier, and I have the privilege to serve as the Executive Director of the Foundation for Social Connection. The Foundation is a national nonprofit. We're based in Washington, D.C., but we serve nationally with the mission of advancing social connection nationwide, rooted in evidence for our collective well-being. And our work translates research into practice, creates long-lasting partnerships and convening opportunities for field builders such as yourselves, and prioritizes social connection as a national value powered by lived experiences. Our work is really rooted in evidence, and we do that in conjunction and in collaboration with our Scientific Leadership Council, which is made up of really the leading academics and researchers in the field of social connection science, as well as our larger scientific network, to make sure that we're bringing the evidence into all the strategies and policies that we're recommending that leaders deploy and implement across scales. We are working, as you can see, our vision on a vibrant society where social connection is at the heart of how we live. And now, one of the challenges, as you can imagine, that we face when we're talking about measurement and measuring social connection and related concepts is clearly identifying our outcomes of interest that you are looking to measure improvements in. And so, for example, we know that loneliness and social isolation maybe are sometimes lumped together, but they are different and separate concepts. And it's important for us to understand the terminology and the definition of the specific construct that we're looking to measure before we dive into how we measure it. So just as, you know, I likely repeat for many of you, but it's always good just to remember some of these definitions. Loneliness is the subjective or measure or unpleasant or distressing feeling of a lack of connection to other people, along with the desire for more satisfying and social relationships. So really that feeling, that subjective feeling, the disconnection between the relationships you wish you have and what you feel like you do have. And social isolation refers to that objective count, having few social relationships, social roles, group memberships, etc. So when we're thinking about measuring both of these, we want to make sure that we're asking the right questions that pertain to both of these definitions. And then I just listed some additional terminology that we talk a lot about as we talk about SILC, which is an acronym: social isolation, loneliness, and connection. So we have definitions around social connection, connectedness, and belonging here as well.
Thank you for grounding us in those important definitions.
Yeah, absolutely. And you can even see here, I listed a couple of key statistics that the way that we talk about each of these statistics shows us what particular construct we're measuring. So for this first one here, it talks about post-pandemic, 58% of Americans experience loneliness consistent with pre-pandemic rates. So really that's talking about loneliness experience, that feeling. You can see on the right-hand side, when we talk about in 2023, 1 in 3 adults age 50 to 80 reported feeling isolated from others. That's kind of a combination. So it's perceived isolation, which we'll talk about a little bit later on. But you can see here how we talk a little bit about loneliness in different statistics and when we're talking about isolation. And it's really important that we are measuring these because, as you can see from these statistics, these are really, really staggering numbers. And we want to make sure that not only we understand the crisis, but then how to intervene.
Absolutely. And you're already painting a picture, starting to paint a picture of how it's impacting certain populations more than others.
Yeah, absolutely. And to take a step back, we kind of ask ourselves the question of why do we measure, right? Why is this so critical? And essentially, as you can see when we list the challenge here, is we don't know what we don't know. And in order for us to really do anything of, significant about addressing these issues, we have to understand them better. And who is this impacting and to what extent? And we want to be able to identify the gaps in our services and the needs our communities are facing in order to design programs and interventions that really work, that are effective and tailored for them. And decision makers, for example, policymakers or funders, etc., need something tangible to base their decisions on. And data related to social isolation, loneliness, and connection is how we're able to really quantify or even qualify with some qualitative research an otherwise very complex and multifaceted issue, and presented in a way that external stakeholders can understand and really see the gravity of the problem. And last, we know that the first time that we deploy interventions, or even the second or third time, it's not going to be perfect 100% of the time. We're going to need to iterate on our programs and our solutions. And we want to maybe shift our approaches to fit the evolving needs of our communities. And so measuring the impact of our interventions, otherwise known as evaluation, which we'll talk a little bit about later on, by collecting data is how we assess what works and what might need to change.
Given the breadth and depth of your organization's work, Jillian, you're the perfect person to paint a picture for us about the current landscape around data and measurement for socially connected communities. And why don't we start by having you share how we measure social connection at various levels?
Thank you for the question. And I don't know if I'm the perfect person, but I'm going to give it my best shot. And I'm sure many of you in the audience and that are participating in today's webinar have great ideas as well. So please feel free to include them in the chat. And we're constantly learning and growing from the great community that's been doing this work on the ground. But to your question, how to measure is one that our field is continuously grappling with. Social connection is complex and multidimensional, and we really haven't reached broad scientific consensus on which survey tools to use and when. And with the variation in how we define and describe experiences of loneliness and isolation, and how characteristics of our communities and systems themselves impact these experiences, it's hard to nail down exactly how to measure. But we've found that there are a few different ways that we can do this today successfully as we continue to garner and gather more evidence and support to build and find consensus for this work. So first, I'll talk about direct measures, and this is really measuring the subjective or objective experiences themselves. Second is going to be talking about proxy measures that are assessed at a community level. And then third, we'll talk about more systems level measures. And so I'll take us through each of these tactics to provide a little bit more information. Awesome. Thank you, Joanne. So first, we're going to talk about direct measures of social isolation, loneliness, and connection. And this is really, the most direct way, as it's called, direct measures. It's for us to understand these specific outcomes of interest or specific indicators. And most commonly, we do this by asking or including questions related to these experiences of social isolation, loneliness, and or social connection in surveys. And we'll talk about where to locate these surveys in just a little bit and some of the data that already exists. But as I mentioned before, there isn't national consensus on survey questions. So different surveys and studies may use a variety of language in their questions. And you can even see here, I've tried to include 4 different examples from different survey sets or different instruments that ask the questions a little bit different. But really what we're getting at is that perceived isolation, so how people feel that they are isolated, social and emotional support, asking about loneliness itself, and then the objective count, or really asking people to map out their social network, is also a way that we can kind of more objectively understand who is in their network, frequency of interactions, etc. And then lastly, thinking about relationship quality. Now, these are a sample set of questions that I've sampled. So when you all see the slides, just know that these are just some of the many different questions, and there is more comprehensive lists within some of the tools on our website. You will see that on the left-hand side, I included the UCLA 3-item loneliness scale. This is maybe one that the field is most familiar with, or practitioners are most familiar with. And this is an example of a tool that was developed by researchers that's meant to assess the incidence of loneliness. And many public health and community organizations refer to this scale and other validated measures to help them understand and evaluate the impact of their interventions. While some might be focused on surveillance, prevalence, and incidence, that one tends to be used as well in understanding how interventions are improving loneliness over time. Wonderful. The next is the community level proxy measures. And it's important to note that, many communities might not have systems in place that capture those direct measures that I just talked about on the previous slide, but that's not to worry, because as systems will mature over time and include more direct measures, you can still access some of the more community level proxy measures. And when I say proxy measures, these are indirect measures, but they're strongly correlated or related to our outcomes of interest, in this case, social connection. And if we don't have data of individuals reporting, I feel lonely and or I feel isolated, we can use some of these other measures to give us an idea about the factors or conditions that we know play a role in the levels of social connection. So for example, we know volunteering and membership in social groups correlates with a higher level of social engagement and connection. So these measures can give us a good picture, an idea about a community's level of engagement. Well, they won't tell us the actual feelings or perceptions of loneliness of individuals. Nonetheless, these proxy measures are incredibly valuable when we're trying to understand the level of social connection in a community, and when we're trying to design community level interventions, how we might do so. And our next layer of measurement, thinking about the most broad, is really thinking about indicators at the systems level. We know that so much of a community's access and ability to be socially connected in a community is related to systemic characteristics and conditions. For example, things like walkability and quality or affordability of transit services, and measures like diversity and segregation can indicate how much interaction there is between different groups within a community. So looking at data related to these systems in our communities can, again, help us just continue to paint the picture and fill it out, that picture of how community members may be able to engage socially and what conditions are leading them to have that ability to be together in person in community.
Absolutely. And you just so wonderfully organized the different layers of data that can be available. And I think it's helping all of us to see that even though it's a complex issue, that we can tackle it by kind of organizing it, our thinking and the way we look at data this way. So thank you so much for outlining that. Now, earlier, Jillian, you reminded us that loneliness and disconnection are not new issues. However, it's important that we examine and approach them in new ways. So rather than starting from scratch, what good data is already available that our audience and community practitioners can access to inform their work?
Very good question. Yes, no need to totally start fresh. There's already a lot of really great data out there. And while not every community or county might have those direct measures, most have plentiful data, including those community level proxy measures and system level measures, and which, again, we can use to continue to paint that picture of community social connection. So on the next slide, I've listed some data sets here. You can see, perfect, thank you. And over the past 5 years or so, more and more national surveys and data sets have started to include direct measures and questions related to social connection, isolation, and loneliness. And on this list here, you can see some of the national data sets that have measures related to these concepts, whether they're direct or proxy or system level. I tried to asterisk the ones that do have that direct measure. And I encourage you to look through some of these data sets, and depending on the population you're working with, see if there's indicators that could be helpful in assessing your community needs and your social connection initiatives. Wonderful. And then as it relates to local surveys and data sets, because the previous slide was more thinking more nationally, there are additional local data sets that include measures at the county or census tract level. Again, I want to note this isn't a comprehensive list, but just some examples that you can start from. And while there are a few resources on this list, including county health rankings, places data, Social Explorer that include most areas and regions, you could also do a quick Google search just to look at your specific state or region or city, and understand if there are specific data sets or surveys that are available. You can see that just going to your local public health department or organization's resources might be a good place to start to see if they've published any data. I did include just 2 examples of this type of resource from California, you can see, and then the New York City community portal. And yeah, feel free to just kind of look through those, and then you could put in your own community and see if there's some similar data sets available.
Well, and we really can't have a conversation about existing and accessible data sets for social connections without highlighting the Foundation's wonderful data dashboard. So tell us about this powerful tool and how community practitioners can integrate it into their efforts to bolster and sustain social connectedness.
Yes, thank you for bringing this up. And of course, in order to have that full picture, you'd like to have, the direct measures, the community level measures, some of those systems level measures, and that can be a lot to locate and compile. So good news, we've done a lot of the legwork for you. With our partners at Healthy Places by Design and IP3 work together to really put this dashboard together at a county level. And it's a platform that we designed to be a one-stop shop for key measures we identified to assess social connection in community. In the dashboard, you're able to select your county, and then it populates the data that is relevant or that's available from national data sets and local data sets. It includes individual community level and system level indicators or drivers of social connection. If you jump into there after the webinar, you'll see that some of the direct measures, so perceived isolation and perceived social and emotional support, are listed as coming soon. That's because those measures were just included in the 2022 BRFSS data set for the first time. And I think about 46 out of 50 states chose to opt into asking questions around social connection, which we are so thrilled about. That data was just released on a county level, and so we're pulling that into the dashboard, and it should be available by the end of this month, which is really exciting. So stay tuned for that.
Very exciting. It's a wonderful tool, everyone. I've used it. So thank you for sharing more broadly about the data dashboard. I'm wondering about communities that may have access to these proxy and system level measures, but really want to access more direct measures of social isolation and loneliness, or proxy system indicators that haven't been collected yet. How can communities take matters into their own hands?
Great question. And we highly recommend that community leaders collect local level data when they can. And here's what we suggest: really first identifying what are the gaps in your community's data, whether it be that you don't have those direct measures or you want to fill some gaps in some of those community proxies. And it's important to think about your community's unique context here. what about your community characteristics or members' experiences do you want to ask about to better understand their experience and level of social connection? Then you're going to, once you kind of have those understanding of the gaps, identify the outcomes of interest. What am I trying to measure specifically? What are you really trying to understand? And then potentially either have surveillance over time and understand trends and how things change, or also help inform what programs and interventions you want to design and build for your specific community. You then can explore validated survey tools to match your specific outcomes of interest. We'll talk about the measurement tools inventory, which is a good starting place on the next slide, which is really a library of different validated tools that exist today. Then you want to make sure that you have a plan to share your findings in some way, right? We want to make sure that we're not only asking questions of our community, but also giving them those answers right back and showing them, here's what we're seeing in our community. Come be a part of the solution, come be a part of our work and our initiatives together. And then lastly, just thinking about how you might use the data. We talk about sometimes survey burden and the time it takes to not only ask people and collect data, but also the time you're asking of your community members to fill things out. So you really want to make sure that you have a good plan in place for what you'll do with the data once you have it. And you can see here that I just talked about the measurement tools inventory. This is a little screenshot of it. It exists on our website as well. And that link should take you there too, that we can share with you all. But you want to make sure you're using evidence-backed or validated measurement tools. And this is also a great way, if you use those validated measures, you can compare your results to others that are using the same validated forms or surveys. And again, this includes many different scales that have been developed specifically related to direct measures. If you go in there, you'll see the specific areas of measurement or the components that we are measuring there. Our long-term goal, of course, is to work towards a standard set of measures for various social isolation, loneliness, and connection outcomes of interest, which will significantly help us in the field be able to compare findings from across the country. So stay tuned for that.
Great. Now, in the last minute or so that we have with you right now, Jillian, let's quickly talk about how to gather data about social connection at the community level to inform programs and initiatives. Why is it important? How should communities go about collecting them?
Yes, another important question, and like you said, it's crucial to measure the impact of the efforts to make sure that the work that we're doing, the programs that we're deploying are actually working or helping us build more social connection in our communities. And there's lots of different resources out there about evaluation of interventions. We linked one, which is a great resource from our friends in Australia, Ending Loneliness Together. But really, just as a review, some of the core components you want to think about. One, planning to evaluate your progress and impact. So collecting data by administering surveys, conducting qualitative interviews, and/or focus groups, identifying those relevant outcomes. So here you're thinking about, what do you want to understand from this process, from this intervention at baseline? So before the participants have participated in your program. And then you want to also ask after the intervention has been delivered to your participant. And this will help you assess, does the intervention actually change the outcome or the status for the individual? And is the program and service doing what you set out for it to do or what you hoped it would do? And then the second is using your data. So once you've collected this pre and post or the baseline and then post or end of service data, you want to understand how you can take this information to continuously improve your programs, your initiatives. Ask yourself what's working, what isn't. Being able to identify new or emerging gaps and needs in your community. Thinking about, does this data point to a demographic change that you weren't aware of that's relevant to social connection work? So really be open and curious when exploring the data to identify new questions and areas for growth. And then lastly, sharing this valuable information with the public, with your program participants, community, and stakeholders to let them know what is the impact of your intervention been and what is still missing from your efforts. And this can also, of course, be impactful for funders Positive outcomes may incentivize them to continue or increase funding for your programs, but also thoughtful and data-backed assessment for why an intervention may not be working or may not be improving outcomes may make a good case for providing new or additional resources to pivot the work.
Wonderful. And to remind our audience, all of the links that you shared, Jillian, in your slides will be included in the resource guide that we'll provide within the next week. So I'm sure you've piqued our audience's interest about this topic and generated questions. So we'll bring you back for the Q&A portion of the webinar shortly. Thank you so much. And I
Thank
want to
you.
welcome Natalie back to the screen. Welcome. On Healthy Places by Design's journey into socially connected communities work, we were so pleased to cross paths with you and your organization, which is doing great work at the local level. Let's start with you by telling us about Wello.
Well, Wello, everyone. We like to use our name as both our name and as a greeting. My name is Natalie Bomstad. I am the executive director at Wello. Our mission at Wello is to really co-create community conditions that are fair and are just to really drive high levels of health and well-being for all. So we are true believers in that people support what they co-create. And so we truly use that philosophy in all that we do, including the ways in which we measure community well-being. I would say at Wello, we really see ourselves as a team of multi-solvers. So sometimes we get the question, gosh, well-being, that is so big, right? That's so big. And if we ask you to come boil the ocean with us, that does seem really big. But at Wello, we really think about how can we maybe have a cup of water in front of us, and how do we work together to really think about the things that we would need to do to boil the water in that one cup. And when we're doing that together, we're building the trust and relationships that allow us to take on those next things. So we really take this approach of kind of starting small, iterating, and really ensuring that as we're doing anything we do at Wello, that we're doing it in collaboration with our community. So at Wello, one of the big things that we say all the time is all people thriving, no exceptions. And so that is a tagline that brings me right into some of our measurement work, Joanne.
Wonderful. I love that. Together we can take one step at a time and tackle it not alone, right? Not in isolation. Now, Natalie, it's apparent that Wello serves in a variety of roles and supports many things for the community. Let's dive deeper into today's topic. What are you and your partners in Brown County, Wisconsin doing to measure and track social connectedness in the community?
Yeah, thank you. You know, back in 2017, we were going through a large organizational transition. And part of that transition was as our focus was on community well-being, how did we have, or did we have measures to adequately track the progress of that, to really assess that as not only an organizational principle, but also of a community value? And, you know, we took a look at the landscape, and, you know, there were a lot of models internationally. You know, we heard from some of those. You know, Australia is doing some really amazing things. There's things across the world that are happening. There weren't a lot of models of communities really doing this. And, you know, I want to give a shout out to Santa Monica. If there's anyone on the call from Santa Monica, I know that we really had a lot of conversations with the efforts that they were doing out in California. But we really took it upon ourselves to say, okay, we need to start, right? And let's look at our process as an iterative process that's going to be dynamic. Meaning, again, thinking about our value to really co-create with community, let's create a measurement approach that can be flexible and nimble as things in community change, because people change and they make up communities. So our approach at Wello is really three-pronged. First, it's a biannual survey. That survey goes out every other year on the odd years. So we're in a gap year this year. There'll be one again in 2025. That asks folks kind of really those subjective questions around well-being. How are you feeling about things around your physical well-being, you know, your mental well-being, your social connections, and those environments that we all live, learn, work, pray, and play in? The second component is really around a longitudinal panel study. So this is a group of around 600 people who've really raised their hands and they've said, hey, you can actually ask questions more often to me. And so we activate this in a number of different ways. For example, during the pandemic, really trying to track people's how mental health in particular was being affected by the pandemic. And what we saw was while mental health was decreasing for all folks, it was decreasing at a higher rate for women. So that allows us to have some more kind of point in time data to take some more direct action. And then the third prong is really around ground truthing. So you'll hear me say it a lot. We co-create with our community, and it's important that we felt that ground truthing was part of our overall measurement strategy. This allows us to really braid in and blend in those lived and learned experiences that are so essential. These first two pieces, a survey and a study, those are point-in-time indicators. We want to make sure that we continue to have that contextual knowledge that you can only get by being in community. So this is kind of the approach that we take moving forward. This right here, so we talked about those three approaches. I'm now going to focus on just kind of solely the survey in particular. Here you can kind of see what our survey timeline looks like from a kind of a year and a half, I would say, 2-year process. So in July of every odd year that survey opens, we have it open for 6 weeks. It's important that we ask it the same time every time we ask it. We live in Wisconsin, and so it matters that we ask it during the summer and not the winter, for example, or start to bounce around when we would ask the survey. So it always is between July and August. We then go through a full analysis process. We have an opportunity to share out the findings with a full summit that we host every year. We do a data road trip, again, making sure that we're getting in front of as many folks as we can to really ensure that people who took the survey can see that the results. Then we implement that into the different activities and projects that we take on as both Wello as well as other community partners. And then we do that survey refinement. So we work with a broad measurement team to continue to refine those questions that we ask. Again, I said community changes, right? And so we want to have a tool that can respond to those changes in real time. So the next few slides, we can kind of go into some of those results.
This is such a thoughtful, I have to just say, this is such a thoughtful and intentional process. And I'm just gaining so much by hearing you lay it out for us. Thank you.
Welcome. So here are a couple of the results. So one of the questions that we ask, and I brought forward a couple of results that relate to the topic that we're talking about here today. One is called Cantrell's Ladder, and you may have actually seen this measure. It's a measure that's used across the United States in a number of different venues. What it asks folks is, it says on a ladder with the bottom being your worst possible life and the top of that ladder being your best possible life, where do you think you are today? Right? And then it asks that same question, where do you think you're going to be in the future? And this is a measure of kind of current and future thriving. And you can see the different ways in which it's broken down into suffering, struggling, and thriving. Because this is a measure that has some good research behind it, there's also, we know specific things about some of those populations who might pick 4 to 6, right? What are some of those other characteristics? This might be part of your community that might be struggling with, access to health insurance. Maybe are food insecure. So there's different characteristics that then we can look at moving forward. So we can kind of go to the next piece here. These are questions we specifically ask that are around belonging, acceptance, and membership. What I'll draw your attention to here is, and something that we were really interested in the finding, what you see here are the percentages of folks who said, I strongly agree, or I agree with the statement that I belong in my community, or that I feel like I'm a member of my community, or I feel like the culture is accepting of people with different ideas in my community. And in particular, I want to draw your attention to the ones on the outside, the belonging and the membership. Those are not the same percentages, right? Mm-hmm. And so this is really one of those moments where we said, what is going on here? Right. And this is where that ground truthing really takes root, really going back into community, really understanding the difference between membership and belonging, where the predominant narrative that we heard is, well, I feel like, yes, I'm a member here. I work here. My kids go to school here. But if I really think about, do I belong? That really instilled some deeper feelings of connection. So folks who felt like maybe they were connected more with maybe it's a faith-based group, or they had a specific volunteer, thing that they did all the time. There was like this deeper level that people considered with belonging compared to membership.
Yes, fascinating.
Right. The next two slides or three slides I have here is just another example of how we can look at this data. So the tool that we have is able to break down into different domain measures, social, mental health, and those environments domains. And you can kind of see, I just added in here from 2021 to 2023, kind of the difference in quadrants of where people are falling on that spectrum. So we can go to kind of go through this next slide, which is the environment slide. So same kind of concept and analysis here, and then we'll move forward for time here.
Well, thank you for sharing that. Just your thought process in analyzing and how sometimes the data you look at just leads to another more granular question, which can really help you tailor your strategies. So this is really strategic and robust of an approach to data measurement. Your partnership is also utilizing mapping in your process to track impact. Tell us more.
Yes, Joanne. So we drank the Kool-Aid when we went to Esri and just fell in love with different opportunities to really use geographic information systems to really showcase the power of place and well-being. Things I'm sure everyone on our call really understands quite closely, or how closely they're related. And so we really wanted to have an opportunity to start to map that, right? And as we were talking with our community partners, one of the things that we really noticed was, I'm actually a very visual person, and other people are very visual people as well. So there's one thing to see that number, to see it in a report, to even see it in a chart. It's another to see it overlaid with place. And so this last data survey, we actually were able to geolocate where people live by census tract. And here you see the result of that. So I just brought forward a couple of those questions. So again, you see that membership question, and the darker green is feeling more like a member of your community than the lighter. And you can kind of see the variation by census tract. And I'll follow up with how we're kind of using that to think about creating action in our community. So we'll just move to the next one here. You see that feeling of belonging. Same idea. These are the census tracts in Brown County, Wisconsin, and so you can see kind of the differences there by census tract. Okay, and then we can move forward there. The last thing, I have about 3 additional just graphs. And what I really wanted to share with everyone today is, when you're taking, or when you're doing population level data collection, right? We have like the Brown County, Wisconsin overall version. And we can learn certain things by looking at it as a whole. There's a whole other set of things that we can learn if we really drill down and look at some different ways of stratifying that analysis, whether that be by demographic groups or some additional kind of ways in which to look at that. So I just wanted to bring forward, here's one around food insecurity, and you can see some of the differences in food insecurity by self-identified race and ethnicity. If we move to the next slide, we can also see that Cantrell ladder, that present. You can see the difference within our Hispanic and Latino population compared to, say the full sample or the non-Hispanic white population. And if you move to the final slide here, we see this question of belonging, and we actually ran that analysis. We work very closely with our LGBTQ plus community here, and they were really interested in, well, what do these questions look like for members within our community? How can we, meaning members of the LGBTQ plus community, really use that to showcase, needed tailored services? And so this is another way in which we've partnered together to really provide that to those organizations that are really leading that work on the ground.
This is so helpful to hear about Wello's comprehensive approach to data to track impact. You also have helpful advice for how data can be used to implement action in communities, and have a couple of quick examples to share.
Yeah, so we'll go through these a little bit quickly, and we can take questions at the end. Wanted to bring forward in the 2022-2024, our community health improvement plan, social cohesion was identified as one of those priority areas. You can see those three kind of key strategies within that area. And really a campaign that came out of this focus area was Belonging Begins Here in Brown County, Wisconsin. Happy to announce that tomorrow in De Pere, one of the local municipalities in our community, they're unveiling a big mural around belonging. So kind of an example of how we can start to be using some of this information, build it into some of maybe these existing systems and structures to help create change. We'll move to the next one. This is the Yield to Your Neighbor campaign. This is again, thinking about what creates social connection. Part of that is really around that systems level accessibility and safety around walking, biking, rolling within your community. So the Yield to Your Neighbor campaign really is around ensuring that folks and that we're bringing together a lot of cross-sector partners to reinforce this idea that you yield to pedestrians in a crosswalk. We are a yield state in Wisconsin. So if you're like, why isn't it stop? We are a yield state in Wisconsin.
Interesting.
So that this is us wrapping a city bus here. The next example is really around thinking about creating spaces where people feel included, where they can see themselves in places of gathering. So this is, these are some murals underneath an overpass that is adjacent to a new, what's called the Shipyard Development Project. So it's a project in collaboration with the city of Green Bay and a whole host of other partners that are really creating places of again, gathering and connection to further kind of community connectivity within Brown County. And then finally, kind of the final example I have here is cultivating community. This is Wello's food system-based work that's centered around well-being. You might be asking yourself, how does food relate to social connection? And it's really about the how, right? So I talked about how we really are a team of multi-sellers at Wello. So wherever we're working, we're thinking about how can we weave in components that also connect people to one another, that connect them to the earth and to their farmers, right? That can really start to create these rich social connections no matter what we're working on. So cultivating community is one of those things that really aims to bring dignity and hope to food insecure individuals across our community by really investing in local farms.
Wonderful. Thank you so much, Natalie, for just really giving us a comprehensive but really local tailored approach. And I know there's lots of questions for both you and Jillian, so I'm going to ask Jillian to come back to the screen and turn things over to Risa to field a question or two from our audience.
Thank you so much. Wow, that was so amazing. Really loved it. I'm trying to grab, we have so many questions and we have two more than we have time for, but we will get to a few of them. And then for the rest of you, I hope you're able to stay and join us for the discussion group. That would be amazing. All right. Spotlighting. Sorry, trying to get everybody here. All right. So the questions, we've got a couple questions here, quite a few actually, that they're loving your stories, your examples. And one of the things that we wanted to know was asked in the question from Adam Green was really around sort of how some of the measurements, especially Jillian, that you mentioned, some of those are unidimensional, whereas we know social connection is multidimensional. What do you think about that? Is there some data to capture the multidimensional aspects?
Really great question, Adam, and great to see you on here. Glad that you brought that up. So just to dive in a little bit more, when we think about multidimensional, a lot of times we think to Dr. Jillian Holt-Lundstad's three-dimensional framework for social connection, structure, function, and quality. Structure being that kind of objective or social isolation piece in terms of the number of contacts and connections and relationships you have in your life. The function is what those relationships or how they serve you. For example, mentorship, volunteering, etc., peer support. And then the quality is really thinking about positive or negative aspects of the relationship. So just because you have a lot in your life might not mean that those are positive relationships, and that can impact your overall feelings of social connection. So a lot of the examples that I gave in my presentation, to Adam's point, are around a specific construct, so social isolation and or loneliness or social connection, etc. There is some work being done as it relates to multidimensional survey instruments. One in particular I wanted to point out was Dr. Matthew Smith, who is another member of our Scientific Leadership Council, has developed what he calls the retrospective assessment for connection impact, or RACI, RACI for short. And there's a long form and a short form, and basically it's used for intervention evaluation, and to look at across all three: structure, function, and quality, all three of those dimensions, as relates to how the intervention has been able to impact individuals. Right now, that is being studied, the RACI new metric, in a couple different places. So I can make sure I touch base with Dr. Smith to see if he would be okay with me sharing that out with the group. I'm sure he would be, but it's a really great tool, and we're hoping that through continued study that we are able to get that validated as well.
Yeah, thanks, Jillian. Appreciate that. And I know we're running tight on time, but there were several questions for you, Natalie. So I'll choose one of the many. And if you can give a brief answer, maybe, 45 seconds a minute, then we'll transition so that folks can get on if they need to at 4, we can go to our discussion group. So there was a question about whether or not what partnerships and connections you have to local and state public health department to do your work.
Great question. Yes, we do work actually in direct partnership with both of those agencies through this process. I think actually some of them are on this call right now, and I actually had a call with them right before this meeting. So yes, we work so from a data perspective, some of our data is actually included in that community needs assessment that is completed in partnership with the health department. And then we do work with our state health department to actually implement actually some specific projects within our community. So currently we are working on a cardiovascular disease heart health grant with the state health department. So there's connection at both ends of that coin, or both sides of that coin, I should say, not ends.
Yeah. Thank you. Thank you so much. All right, hang with us a couple more minutes, folks, and then we'll be transitioning to the discussion groups. Thank you, Jillian. Thank you, Natalie. So amazing. Really appreciated it. And I know lots of people are gaining all kinds of great information from what you shared. So we're excited to be able to also share this out afterward by the recording and so on. Wanted to let you all know that we have the next webinar that we have coming up is on nurturing co-generational social connections. We're very excited about this one too. We have Eunice Lynn Nichols from who is the co-CEO of CoGenerate, joining us, as well as Daniel, and I did not ask how to pronounce that last name, but maybe some of you know him, as co-founder and CEO of Simpara, joining us, and some great stories there. So please make a note in your calendar about that one, and you can register as well today for that. Also, to stay up to date on all of our future webinars and engagements, visit our webpage, which Becky is chatting out now for you, and watch a reminder to watch your email inboxes to receive the recording, slides, and resource guide from today's webinar within the next week or so. You'll be the first to receive it, and then we'll disseminate it more broadly next month. Finally, we just love to know whether or not this has been helpful to you. So if you could bear with us one moment, answer this question. Did you gain something of value during today's webinar? That's a simple yes or no. And then after you've answered that, if there's anything you'd like for us to consider, please share something specific that you gained or what could have made your experience better. That will be the second question momentarily. So definitely appreciate that. And then in the chat, if there's any issues or topics related to socially connected communities that you would like to learn more about, please put those in. We look to your answers. And again, we have options for peer connection sessions and other types of things coming up. So really, really appreciate that. And we've had 97% of people say yes, they gained something of value. So thank you so much for your responses there. Finally, we just want you to know that next up is the discussion group. We're hoping many of you can stay and join us for that. We're about to submit give you the Zoom link, and what you'll need to do is sign out of this and register and sign into that. It only takes a minute or two, and that gives you a chance to really continue to ask questions, not only of our presenters, but of each other as well, and to do some learning. So we're hopeful that you will join us. Becky, if you could put the link in there now, and then from there, we just want you to stay connected with us. Connect with us on LinkedIn, sign up for our newsletter. We have a YouTube channel where we post all of these recordings, and we'll send all of these links out to you as well. If you're worried about grabbing those now, you can get those later, but please use your phone, grab those QR codes if you'd like, and stay connected. And to all of you still on the call, thank you, thank you, thank you for joining us, for staying with us to the very end, and we will see you momentarily in the discussion group. Thanks so much.